Hi, hello, namaste, good evening to all. Myself Murali.P.G, one of the first educator in Unacademy. Here today, let us have the discussion on human reproductive health under YouTube class of Unacademy. So Unacademy is one of the good platform to achieve the goal in oncoming Karnataka CET with the following important kind of course package for the students. So we are focusing on Karnataka CET 2021 aspirants. So under this the 12-month plan, 6-month plan and 1-month plan is there, and that includes following important types of concepts or the features. So clear entire theory followed with the doubt clearance, then mega quiz, then MCQ for individual topic will be there. So for this purpose, we introduced plus course and use my referral code Murali.P.G 853057 to get 10% off with respect to the price value. And if you once subscribe, you will get unlimited access to these classes. So best plan is 12 months. I will going to focus on this one because according to the price comparison, this is best one to the students. And another batch, it is a comprehensive batch we introduced from last 2 months. Here it is a 6-month course duration. Complete syllabus is covered, tips and tricks by top educators, topic wise practice questions, full length mock test will be there. Myself, I am taking one of the batch under Karnataka CET comprehensive batch. Along with me, the 3 other respective educators will going to take their topics and use my referral code and get 10% off regarding with the price value. Okay, that is the thing. That is the second course what we introduced. And third one is a champion batch where PCM, PCMB and PCB batch will be there. Started on 15th of October. Enroll your name for this one also if you want. And here it is having the features like that of comprehensive batch. Okay. And fourth one, daily T20 free practice test for Karnataka CET starting on November 2nd. Enroll for the test, attempt it live. Let's crack Karnataka CET today. And here, to subscribe for this special class, I am taking the special classes from last 7 months. So, how to open the access to the special class? You should download the Unacademy Learners app from Play Store, Google Play Store, and install it. Then go to Karnataka CET, State CET division or that sector, and in that section select Karnataka CET and search for my name Murali.P.G and use my code, referral code Murali.P.G 853057. So I am with the biology. So under biology, use my name and use this referral code, and you can get open with the special class. Special classes are free to you, but plus courses are going to be there only for the subscriber. Okay. So by this brief introduction, now I will enter into the reproductive health chapter. Okay, with the MCQ. In the previous classes, I discussed the concepts on MCQ related with the reproduction in organism, sexual reproduction in angiosperms and human reproduction. Today is the fourth class that I am dealing with the reproductive health. Welcome to all. Welcome to the class Unacademy YouTube class. So the next class we are going to have, that is biotechnology principle and process, that is on 14th of this month. The time is 9 p.m. Now let us start the discussion on human reproductive health. So Manoj, welcome to the class. Namaste. Good evening. Okay. Now I will move on to the class with respect to reproductive health. So growth curve is normally what? So if you take growth curve by taking the period and growth in the x-axis versus y-axis, we will going to get one curve. It is S-shaped curve. Almost a S-shaped curve will be there. Lag phase, log phase, and exponential phase. Lag phase, log phase, and exponential phase, and stationary phase will be there. So that gives a S-shaped curve for the growth of organism. Then second question for this class. Okay. The second question for this class here. Yes, welcome to the class. The causative agent of syphilis is which one? Syphilis is sexually transmitted diseases. Under that, syphilis is one of the thing. And which causative organism responsible for that one? Yes, you are right. For the first question, B is the right answer. For the second question, C is the right answer. Treponema pallidum. Treponema pallidum is the causative agent for causing of syphilis disease in the case of human being. It is coming under sexually transmitted diseases. And third one, World Population Day falls on, or we are going to celebrate that World Population Day, that is on which month and date. So that is 11th of July. 11th of July is the right answer. Yes, for the previous question, Shreyas, you are right. C is the answer for the second question. For the third question, A is the answer. A is the answer. Okay. And the next question number 4. Study of the human population is known as what? Human population concept under ecology or under reproductive biology. So what is that terminology? So it is called demography. Demography is the study of human population. Okay, geography, anthropology, then anthropology, these are not the right answer. B is the right answer, demography. Then, what is the function of copper T? What is the function of copper T? So it is what? Intrauterine device, isn't it? Intrauterine device, IUDs, isn't it? IUDs, intrauterine device. So that will going to stop what? Cleavage, checks mutation, stops gastrulation, and D stop fertilization. So under this copper T, it is the D is the right answer. Yes, Manohar, welcome to the class. Good evening. So D is the right answer because this will going to prevent the meeting of sperm with the ova. So stops fertilization. That is the copper T. So copper T is going to release the copper. Yeah. Copper ion that will going to reduce the motility of sperm. So that is the right answer. D is the right answer for fifth one. Then sixth one. Yes, yes, you are right. Yeah. Sixth one. Amniosynthesis. Amniosynthesis is a process of what? Why it is going to be there? What is the main thing? It is the determined disease of embryo. Know about brain disease, grow cells on culture media, determine mutations? No. Is it to determine disease of the embryo? So amniotic fluid is having the chromosome. So study of the chromosomal pattern of amniotic fluid. It is called amniocentesis, to know about whether there is any genetic disorder in the developing oncoming fetus or that child. So that is what C is the right answer. Yes, it is not D. Okay, C is the right answer for sixth question. Then seventh one. Saheli is what? What is Saheli? So it is very simple. It is an oral contraceptive for female. So under contraceptive methods, the use of pills or tablet. So Saheli is one of the tablet, and it is usually utilized to overcome unwanted pregnancies, unwanted conceptions. So it's a contraceptive device, contraceptive pills for females. Okay. So the answer is A for seventh one. Then eighth one. Test tube baby employs which of the following technique? Is out of the following technique, one is considered as test tube baby. Which is that one? ICSI, ZIFT, GIFT, IUI. So ICSI refers to intracytoplasmic sperm injection. Zygote intrafallopian transfer. GIFT that is the gamete intrafallopian transfer. And IUI refers to intrauterine insemination. So right answer for test tube baby, it is the zygote intrafallopian transfer. Zygote is going to be formed in the artificial medium in the laboratory condition after the fusion of donors sperm and ova, and that zygote is going to be directly given to the fallopian tube of the female. So that is what later the usual phenomenon of development is there, and the uterus wall, and that is what ZIFT. It is a zygote intrafallopian transfer. It is also considered as a test tube baby. And plus which of the following technique? So here another one is in vitro fertilization, embryo transfer, isn't it? That is also possible. Then histamine is secreted by which cells? So coming under our human disease regarding with the, yes Manohar, you are right, ZIFT. Histamine is one of the important material or chemical which is going to be produced from the mast cell during the time of allergy. Okay, mast cell. Then what is this AIDS? AIDS is what it will going to do, whether it is reduced or it's autoimmune disease or inability to produce interferons. So AIDS refers to here reduction in the number of helper T cell. Reduction in the number of helper T cell, that is the HIV AIDS. Okay. So why? Because here directly it will going to reduce the helper T cell number. Helper T cell is important to guide the B lymphocyte to produce the antibody. So there is a reduction in the production of antibody. Overall deficiency of immunity will be there. There is acquired immunodeficiency syndrome. Result in the group of symptoms, that is nothing but syndrome. And as a result of that, gradual reduction in the immune power of the person who is having that HIV infection. So HIV directly entering to the helper T cell and destroying that cell. Then in which countries of Europe the population has decreased from, if you take last decade, okay, in which countries of Europe? So it is Italy and Spain, where population was decreased. So if you take the reproductive age of population, it is very less, and the number of young generation is less in that country. Then effect of high population growth are which one? Decrease in the resources, increase in poverty and malnutrition, overpopulation related problems, or the above. Which is the right one? It is the T is the right one, or the above, because along with this ABC, some of the other things are also there, the effect of high population. So right answer for this question, yes, it is D is the right answer. Yes, Saurabh Patil, welcome to the class. Good evening. So all of the above is the right answer for the question number 12. What is the rank of India in population growth? Not total number of population. With respect to population growth criteria, if you take, it is in second. First is China, second one is India, population growth. Even in the number of population also, China comes first and followed by India, isn't it? Then, which country ranks first in population? Just now I said the answer, isn't it? That is C, China. China number one in the population, number of population, and also increase of population growth. So answer is 14th for 14th. C is the right answer. Okay, sorry. Next, what was the increase in the size of population from 1951 to 2001? Almost about 50 years with respect to India. What about the number of population? So it is 3 times higher. 1951 population comparison with the 2001 population. What about the total increase? It is size of the population. It is 3 times increase. Okay. What is the main factor affecting the population growth? Population growth. Okay, main factor affecting the population growth. Here, A, increase in the healthcare facility, better lifestyle, increase in the birth rate and decrease in the death rate, industrialization. The major important, more relevant answer is increase in the birth rate and decrease in the death rate due to medical good facilities, isn't it? So right answer for this question number 16, it is C is the right answer. Yes sir, for the previous yeah, you are right. It is all. So if you have any doubt, you can ask, okay, with respect to any questions. If you have any queries, please let me know, okay. So increase rate and decrease in the death rate will going to increase the population growth in drastic level. What is our main goal to control population growth? Main goal to control population growth. Decrease in the death rate, decrease in the birth rate, say decrease in the death rate, decrease in the birth rate, organizing several programs, promote family planning programs. So 17th one, which is the most related things, it is the important thing is decreasing the birth rate. Decreasing the birth rate, that's all. If you are going to have the several programs or family planning programs, but they are not following this one, the ultimate step is decreasing the birth rate. That is going to give a more sophisticated answer for this control of population growth. Okay. Next question number 18. Is in total 30 questions are there. Okay. Yes. Yes, Shishika, welcome to the class. Good evening. Can give the answer for any questions, okay? Let me know the answer. So for Shishika, it is not C for the previous question, that is 17. Yeah, of course 16, it is C is the right answer. Shishika, for 16, it is C is the right answer. For 17, it is B is the right answer. And for 18, what is the reason for popularity of barrier method of family planning? Barrier method, use of condoms, use of copper T, etc., etc., diaphragm or lipid slope, etc. In that, condoms are most popular thing, barrier. The absence of side effect, comparatively more reliable, protection from sexually transmitted diseases, both A and B, which is the right answer for 18th one. Right answer is D, both A and B. The absence of side effect, comparatively more reliable, use is very simple, and protection from sexually transmitted diseases. And so right answer is D. Okay, of course they give protection from sexually transmitted diseases, but in the case of other things, copper T, etc., it is not possible. Only for condoms. For condoms, if it is asked, then all the three are okay. Out of that condom, if you are using other kind of barrier method means not only condom, then it is with A and B generally. Okay. Yes, Shishika, for 17th one, B is the right answer. You are right. Good. Next question number 19. Which is the physical barrier method for family planning in females? In the case of females, condom for male, condom for female, diaphragm, both B and C. So 19th one, the right thing is condom for female and diaphragm can be fixed with respect to uterus wall, so unable to have the implantation. So right answer is D. Both B and C are the right options for this 19th question. So the right answer, it is D is the right answer. Okay. So for 19th question, answer is D. Then 20th one. Which of the following is not a natural family planning method? Periodic abstinence, interruption coitus, chemical method, lactational amenorrhea. Out of 4, which is not a common thing, that is the chemical method. So chemical method, jellies and chemical like insect spermicidal things, so it is going to kill the sperms. That is not the natural family planning. Periodic abstinence, interruption of coitus, lactation amenorrhea, these are right. So which is not in a group, it is C is the right answer. Okay, chemical method. 21st. Which of the following is not a variation of diaphragm? Conical cap, umbrella cap, venule cap, A and B both. So if you take the diaphragm shape, etc., so it is the thing. It's not a variation of diaphragm. It is the venule cap with respect to the structural character. If you take, C is the right answer. Then 22nd. Arrange the following intrauterine devices in chronological order: non-medical IUDs, copper IUDs, and hormonal IUDs. Non-medical intrauterine devices, copper inducing kind of intrauterine devices, and hormonal IUDs. So which is the first, second and third with respect to their medical background? So it is B is the right answer. Second, first and third. Second is non-medical IUDs. Then copper IUDs. First is the copper IUDs. Second one is the non-medical, and third one is the hormonal IUDs with respect to intrauterine devices, the chronological level. Then, from which day of menstrual cycle the hormonal contraceptive pills should be started? Hormonal contraceptive pills are going to be taken for the to overcome the unwanted pregnancy. So the menstrual cycle period for about 28 days in that total thing. So in which day we have to start the use of contraceptive pills? So it is from 5th day onwards. So the first 5 days are menstrual flow days, days, and next is the proliferative days, isn't it? From 5th to 25th day. So continuous intaking of that tablet is essential to overcome the unwanted pregnancies. The 24th question. Yes, Shreyas. It is for which question? B. You given Shreyas, you given B as the right answer. For which question? Whether it is for 23rd or 22nd. Yeah, for 22nd it is B. Okay. For 23rd it is A. Okay. Yeah. Anyhow, your answer is right for 22nd question. Then which is not related with the reference to hormonal contraceptive pills. Hormonal contraceptive pills. Okay, 22nd, you are right. Yes, yes. So, prevent ovum to release from the ovary, thicken the cervical mucus, inhibit sperm penetration, partial activation of cervical mucus. So 24th, it is D. D is the right answer, which is not related with the reference to hormonal contraceptive pills. Prevent ovum to release, that is right. Thicken the cervical mucus, that is also right. Inhibit sperm penetration, that is also right. But partial activation of cervical mucus is not related with the respect to 24th question. So D is the right answer for 24th. So for 23rd, it is A. Yes, you are right. Yes. 23rd, it is A. 24th, D is the right answer. Next question, 25th. Okay, 25th question. Which are the permanent method of family planning? Permanent method of family planning. 25th question. Am I right? 25th? Yeah. It is vasectomy, tubectomy, condom for female, condom for male, copper T and pills, vasectomy and copper T. The right answer is A, vasectomy and tubectomy. In the vasectomy, vas differential is going to be cut and going to be tied, so the sperms cannot enter into the external genitalia of male. Then tubectomy, where fallopian tube is cut and tied with respect to both ends. So ova is not going to be entering to the entire part of the oviduct where fertilization is going to be there. So it is a permanent method to overcome unwanted pregnancies in the case of human being. So that is vasectomy and tubectomy. Yes, Devesh. Good evening. Namaste. And 26th, in vasectomy, which part is tied and cut? Cut and tied. Okay, cut and tied. So cut and tied. So replacement of the words. Okay. First cutting, then tidying. So 26th question. It is epididymis, vas deferens, ejaculatory duct, urinogenital duct. So it is not urinogenital because it is a common passage for urine also. It is not possible. What is epididymis? Epididymis is the temporary storage area for the sperms. What is vas deferens and ejaculatory duct? So 26 the it is the vasectomy, isn't it? Vas deferens is tied, sorry, cut and tied. So 26th question, B is the right answer. Yeah, 26th 25th it is A, you are right, Saurabha. And for this one it is vasectomy, tubectomy, that is also right. And for 26th question, A is the right answer. Okay, 26th B is the right answer, 25th A is the right answer. Next, 27th question, which part is removed in tubectomy? Tubectomy, or removed means it is going to be cut down and tied, a small portion. Which is that one? So 27th question, it is funnel of fallopian tube, then ovaries, fallopian tube and uterus. It is usually releasing part of the receiving part of the ovary. It is what fimbriae with the fallopian tube, isn't it? Fallopian tube in a funnel shape. So in that part, if you take a fimbriae with the fallopian tube, it goes like this, isn't it? So here we can observe the cutting and tidying of both ends. So here the ovary is there, isn't it? Ovary is there, going to release the ova, and this is what our uterus layer, isn't it? So anyhow, the answer. So answer is C, fallopian tube. Is the right answer. Then, what do you mean induced abortion? What is that? Induced abortion. Voluntary termination of pregnancy after fetus become viable. Voluntary termination of pregnancy before fetus become viable. Fetus removed at incomplete gestation month. Accidentally fetus is lost. So 28, it is voluntary termination of pregnancy. That is right. But what about after fetus become viable? After fetus become viable, voluntary termination of pregnancy before fetus becomes viable. So here the abortion is going to be done with respect to B, voluntary termination of pregnancy before fetus becomes viable. After that it is viable agam. So after first trimester it is not going to be, sorry, answer is A, not B, sorry. Just a minute, I will wait erase. The answer is A, become viable. So viable fetus is going to be taken out. So termination of pregnancy, it is a voluntary measurement. That is the abortion. Okay. Medical termination of pregnancy, MTP. Isn't it? MTP. Next, question number 20. Yes, Manoj, for 28. 28B. No, it is A. Okay. Saurav Patil, A. 28. It is A. How it will become B? Voluntary termination of pregnancy before fetus becomes viable. Viability is there. It is induced. Here we are inducing the abortion. Here we are not naturally. We are not going to do the thing. Inducing by the administration of medical treatment. So it is also called medical termination of pregnancy, isn't it? So got it? Yeah. Then, what is the rate of induced abortion per year across the world in number? Approximate number. It is how much? About 45 to 50 millions in the entire world. Okay, induced abortion, MTP. So, recurrent or the MTPs are once again if it is repeated, then it is not good, not at all good to that woman. Okay. And last question, which are the problems related to the legal induced abortions? Problems related to legal induced abortion. 30th one, emotional and moral, religion and social, mental and physical, both A and B. So it is the A, emotional and moral. Problems related with legal induced abortions with respect to that woman. Vinika, welcome to the class. So emotional and moral, okay? It's not mental and physical. It is A is the right answer. So by that we completed the questions. So if you want to get more things from my side, you can join to the plus class, especially made to the student. Especially it is made to the student. So yes, maybe the answer is A. Okay, it's not D. Plus subscription, comprehensive batch of courses, that also good, and another one, champion batch. So if you want to join to these courses, you can have the Unacademy Learners app. Go to that Karnataka CET section and select biology. Under that you select my name, Murali.P.G, and my referral code is Murali.P.G 853057. Even to access to the special classes, you have to use this method. Okay, not only for subscription for first class, to get my special classes also. So special classes are there, special class for different topics, and I have taken several special classes from July onwards. Now also I am taking. So if you want to join to my special class, go to Unacademy Learners app, install it. In that, go to Karnataka CET, under that biology, search my name Murali.P.G and use my referral code Murali.P.G 853057 and use this code for the plus course subscription. Also get 10% off with respect to price value. For subscription to the special class, no need of paying. Okay, for plus course, special type of course, you have to pay, not for special classes. Okay, you can join the special class and you can have plus course. So if you want more things from my side, you have to join the plus course related with theory and MCQ, doubt appearance, etc., etc. So thank you one and all. Thank you. We will see you again in the next class on 14th. Okay, so thank you. Good day to all.